To help ensure the health and safety of all of our students and staff, both adults and children must be pre-screened before heading to campus each day. Every family will receive a health guide with 10 simple questions to help them complete this process on a daily basis. If you answer yes to any of the questions, your student must stay home from school. You should report their illness and symptoms to the school attendance office, and you should also follow up with your physician as needed. Now, let's review the 10 questions. 1. Does your child have a fever over 100.4 degrees? Or has your child had a fever requiring the use of fever-reducing medication to bring it down in the last 72 hours? 2. Does your child have a sore throat? 3. Does your child have a new uncontrolled cough that causes difficulty breathing? 4. Does your child have diarrhea or vomiting? 5. Does your child have new onset of severe headache, especially with a fever? 6. Does your child have a recent loss of taste or smell? 7. Does your child have congestion or a runny nose? 8. Within the past 14 days, has your child been in close physical contact with a person who is known to have laboratory-confirmed COVID-19? Close contact is defined as being 6 feet or closer for a total of 15 minutes or more. 9. Is your child currently isolating or quarantining because they may have been exposed to a person with COVID-19 or are worried that they may be sick with COVID-19? And 10. Are you currently waiting on the results of a COVID-19 test for your child? If you answered yes to any of these questions, your student must stay home from school. Your student's ability to return to school depends on their symptoms and situation. You should always consult with your school regarding your specific situation. Guidance on when to return will be the same whether your student is ill on campus or at home. So, you can also use the protocol for symptoms reported at school document found in your Welcome Back packet as a guide. That list is as follows. If your child said yes to one low-risk symptom, which include fever, sore throat, fatigue, nausea, headache, or congestion, then your child must stay home and may return to school after 72 hours if the symptom resolves without fever-reducing medication. However, if your child has 2 or more low-risk symptoms or 1 or more high-risk symptoms, which include uncontrollable cough, loss of taste or smell, and difficulty breathing, they must stay home and may return to school after 72 hours if symptom-free and A. A healthcare provider provides written alternative diagnosis, or B. They receive a negative COVID-19 test result. If your child is ill and they test positive for COVID-19, then your child will be required to isolate for a period of 10 days and must be symptom-free for 24 hours without fever-reducing medication prior to returning. A copy of this procedure is available at sanjuan.edu/COVID-19. Please keep in mind that health guidance continues to evolve as we learn more about COVID-19 and conditions change. San Juan Unified remains committed to implementing new guidance quickly if needed. Thank you for doing your part in keeping our school communities safe.